So we will proceed for the assessment for the peripheral vesicular assessment. First, you need to palpate the bronchial artery, and also auscultate for the blood pressure in both arms. So after that, lightly palpate, and also lightly palpate the carotid artery for the elasticity, and also for the palpate the carotid artery for the elasticity, and also for the strength, and also auscultate for the carotid arteries with stethoscope. So you need to auscultate the carotid arteries of the patient with stethoscope. So after that, inspect and palpate the upper. So you need to inspect the upper extremities of the peripheral of the patient. So inspect the upper extremities, and also inspect for the jugular vein, and also inspect for the jugular vein if head is elevated. Then after that, inspect and palpate for legs. So inspect palpate the legs. So for the collar, palpate for the collar if there is masses, the lump, and also palpate for the tenderness. So, and also the temperature, you need to know the temperature of the legs of the patient. So the sensation, after that is the mobility and condition of the skin, if ano ba siya, pale, jaundice, ganon, you need to assess it. So after that, the femoral pulse. So yung femoral pulse, it is yung sa private pulse natin, sa private part rather. So after that, after we go back to the popliteal pulse. So we must bend the knee of the patient, and also extend the foot, and check for the tibial pulse, and also check for the tibial pulse for the woman's sign of the legs of the patient, and also we must check for the heart sufficiency. So tataas natin yung paa ng patient. So you need to observe if magbago ba yung color ng legs ng patient, ng knee ng patient. So if meron ba nagbago due to the mga temperature, ganyan, yung mga blood flow, so ganon, mga 60 seconds. So we must if pagbaba mo, you need to observe the color. So wala naman siyang pinagbago. So after that, check for the competencies. After that, check for the competency of the valves. So check for the competency of the valves of the client. Check the competency. So compare the venous. So compare the venous and also the arterial. Compare the venous and also the arterial insufficiency. So after that, so if arterial insufficiency of lower extremities. So if na-check mo na siya, so if the arterial insufficiency is found, you need to auscultate for the renal pulse, for the iliac pulse, femoral pulse, and also for the aorta. So that's the assessment for the peripheral vesicular assessment. So after that, discard all the equipment, then return all the equipment in appropriate place, then wash hand and observe infection control, then document findings in client record.